Hey there, I'm Dr. Josh, and I want to talk to you today about how to grow trust with your patients. Today's study that we're going to be talking about is titled Health Self-Efficacy Among Populations with Multiple Chronic Conditions and the Value of Patient-Centered Communication. Now, this is in the Journal of Advanced Therapy in 2016. It's by Rutten, Hesse, and a few other providers, again, published in 2016. What the interest of these people, of these researchers was, is does patient-centered communication improve self-efficacy regardless of chronic conditions or the burden of chronic conditions? So when we promote self-efficacy, can those people who are dealing with multiple chronic conditions, can they still guide themselves through the process, right? Or is there a point where people get overwhelmed and just say, hey, I can't do it anymore. I need some help. So that's what they're looking at. And I want to read you a line in here because it's just filled with juicy details. By the way, if you want to build the trust of your patients, even those dealing with chronic disease burden, and you want to grow your office, then check out trustdrivencare.com. Again, Trust Driven Care is education and software that helps you communicate, as in patient-centered communication, in a way that works for your patients. I'm going to talk about this research article, and then I want to talk about some of the features we have in the system that will help with this. In the introduction section here, the authors state, patient-centered communication has been conceptualized as serving the following 6 functions. Number 1, fostering healing relationships. Number 2, exchanging information while demonstrating sensitivity. Number 3, responding to emotions by acknowledgement. Number 4, managing uncertainty around disease. Number 5, making decisions through open exchange of information. And number 6, enabling patient self-management by helping them navigate the healthcare system and identifying resources. So what the heck does that have to do with our software and our training? Well, it's this. Let's identify each one of those patient-centered communication, and then I want to compare that to one of the features we have within our software. Our software is built around the idea of communicating with your patients in a way that is patient-centered so you can grow your impact, get the patients to fulfill and complete the care that you, the smart provider that you are, wanted to give them. That means they're going to have better effects. Their family's going to notice. Their friends are going to notice. They're going to refer you more patients and more of their friends because they conceptualize you being the solution to their problem. If people don't complete their care plan, they're less likely to refer. It's just a fact. If you assign me 12 visits of core strengthening for my back pain and I come in twice, the likelihood of success is very low. So how do we combat that? Well, number 1, it says foster healing relationships through the development of trust, mutual understanding, and empathy. Well, how do we build trust and empathy? One of the best ways is asking questions and providing a response. So in our software, we have a section where you can provide surveys, right? So you could build a simple survey to ask 4 questions before that patient ever attends your office. So I'm a chiropractor. So some questions I would ask are, is there numbness and tingling, right? Do you have, if in the case of low back pain, is it more painful to bend forward or bend backward? I would want to know those things, and that's going to help me in my diagnostic process. Number 3 is this the first time you're dealing with low back pain? And if not, how many times have you dealt with it in the past, right? And then number 4, I would ask, how can you best describe the pain that you're feeling? Is it burning, aching, numb, tingling, sharp? Those things will help me classify each condition. There's probably 3 or 4 questions you could ask every one of your new patients to help build that empathy and trust. Now, what's really important is don't just take in information, but send it back out. That's why one-way messaging platforms don't work in healthcare. They don't give patients the feeling of increased trust and empathy. So if you're just sending out announcements about here's your appointment time or this is where our address is and not allowing for questions on return, the measures of trust will just be lower. If you don't think that's true, try it with your spouse or partner for a week. Just make one-way communication statements and say, this is what we're doing, when is dinner, I'll be home at this time, and don't allow for any response back. It will not work in your personal life. It doesn't work with your patients. Anyways, back to the study. So that's how we can foster those healing relationships with trust and empathy. How about exchanging information while demonstrating sensitivity? One of the great features in our software is what we call membership courses, or it's an ability to build a course that only certain people who meet criteria have access to. So let's just say that somebody has been in your office. You can identify them as a current patient, and you could open up certain training modules or education modules where you could cover more information that maybe you just don't have time for in the patient visit. So again, I'm a chiropractor. I spend about 15 to 30 minutes with every patient, but there's no way I can cover everything about their pain there. For example, if I was taking care of a patient who had disc-related pain, I'd want to include a lot of details on nutrition and sleep position and how important those things are to getting better. But when I'm in with the patient, they want hands-on care, and that's the only opportunity I have to deliver that. So instead of doing the education, I could rely on our membership courses to deliver the information when they're not in the office or asynchronously. And it would also allow them to show their spouse, partner, or somebody else who couldn't be at their appointment with them what I was talking about or the education. That way they can work together. When it comes to things like sleep hygiene, if you're sleeping with your partner or spouse and you want to change your mattress, change the temperature, change the situation, those things affect them too, and it's worthy of discussion. All right? So exchanging information is easy. Number 2, responding to emotions by acknowledging and supporting their emotional reactions during treatment and recovery. How can you do that? I think it's great to start a two-way text communication chain, especially on the front end of a visit, by just sending them a message after their initial exam. Hey, Mrs. Johnson, it was a pleasure to meet you. I look forward to working with you, and I just want to check in tonight. How are you doing? Asking an open-ended question where they can respond, and maybe you text back 2 or 3 times. Now, this comes from me. I used to make a phone call and call every single new patient the night of their initial exam. They loved it. I hated it. The problem was some people would just keep talking and talking and talking and asking questions, and I'd be on the phone for 3 to 5 to 8 to 12 minutes with each new patient. I wanted to go home. So with text messaging, it's great. We could automate that message. So you could fully automate the sending of that message just based on the fact if a person came into your office. You could have a message that goes out automatically the night of the first exam. But I'm going to do one better. I'm going to tell you a way to build some more trust and empathy. I don't automate it. I send it out, and I often use some personal fact that was revealed in that initial visit to punch up the message. So if I say, hey, Mrs. Johnson, I want to check on you. And if Mrs. Johnson admitted that she has a dog named Scruffy, I found that people connect, and that builds trust. So I say, by the way, how's Scruffy doing? If I include that in the message, Mrs. Johnson realized I was listening to her. I stored that information, and now I'm giving it back to her, and that's how we build a relationship. So sending out that initial message. If the person has some questions, that's okay. We can answer a few questions over text. And with our platform, if they ask a question that requires a phone call, like, yeah, is it normal to have more numbness in my foot after treatment? That would be a red flag to me as a chiropractor. I can immediately hit call, and I can call them and make sure I understand that. Maybe I need to send them to the ER. It's okay. Those things happen, but at least we're communicating. Next up, managing uncertainty around disease. We're always scared of things we don't understand. So that uncertainty breeds anxiety within patients and anxiety around their care providers, their husband, their wife, their spouse, partner, brother, sister. Maybe it's a parent-child relationship. Whatever it is, that uncertainty is a killer. So what can we do? Number 1, we can provide a recap, a short text message where we include the details of what we found and the details of what we're going to do. That can do a lot to raise trust and tamp down that anxiety. What else can we do? We can provide a membership course or a video that is private, meaning only those who we've treated get to watch it, but that private video gets sent out to them. Maybe it's a series of 4 videos. In a parent-child relationship, maybe you want to tell the parent, here's what to look for, and here's when to call our office if there's an emergency. With video, you could also provide pictures of this is normal and this is too much. So for me as a chiropractor, I might say it's normal to be bruised sometimes when we work in areas. It's normal to have pain and soreness. What's not normal is an increase in your numbness or an inability to move. So I can include that information and give them that membership course or access to that membership course after they've come in, right? I can provide a gate of when they have access to certain courses and when they have others. I can also send out requests afterwards for more information. Again, I can send out those surveys and collect information like, how did you feel after your first visit? Or I can automate it to automatically go out the morning after their initial visit, right? It depends on what kind of provider you are and the things you want with your patients, but these are ways to build that trust. So let's go next. Let's see, making decisions, right? through an open exchange of information. Again, making that decision and exchanging information is built on communication. We can provide information through courses. We can ask questions through surveys. And in fact, with our software, it's so robust. This would take a little bit of building, but if you want to ask certain questions on survey and then based on the answers, open up certain courses. So for example, if I have more pain leaning back than leaning forward, as a chiropractor, I know that's facetogenic, right? It's from the facet joints. And I can have a course that opens up when they say it's more painful if I lean back. We're going to send you to our extension biased back pain course. I'm going to keep the disc pain course closed because I don't want them to have too much information so they can't make a decision, right? A confused mind never moves. So that will help with making decisions. Lastly, enabling patient self-management by helping them navigate the healthcare system. So how can we be of service and build that trust and empathy with our own or with our own patients? If you need to provide a referral, again, as a chiropractor, I might refer for x-rays or MRIs. I could send the people an automated text that has all the information of our preferred radiology firm, right? Here it is. Here's a map link location to it. I could say this is a picture of Wendy, who works at the front desk that has a great relationship with many of our patients. But helping them navigate by sending them the right information at the right time based on their needs is another great way to build up that trust. So all in all, we have that patient-centered communication. And again, what is patient-centered communication? It's providing information, answering questions, and making sure, above everything else, that every form of communication is two-way. Don't, whatever you do, exchange in one-way communication. Just making announcements about when your next appointment is doesn't allow for them to answer questions. What's worse is a lot of software send messages out through text message, but the number varies every time. That is eroding the trust levels that your patients have with you. It's like there's a suspicion about why are you hiding behind all these different phone numbers. With our software, you can have one unified number, whether they text, call, doesn't matter, it will connect with them. All right. So I hope that's useful. Again, the study was health self-efficacy among populations with multiple chronic conditions, the value of patient-centered communication. Sure, it's easy to do doctor-centered communication where we make announcements, but let's be patient-centered to build trust and grow your office. I hope that's useful.